Story 1. My aunt had medical health insurance. Then things went south and she had to go to a nursing home. They covered the first 100 days of stay partially, but what happened afterward was not something anyone should have to experience. After the first 100 days, insurance stopped coverage, and she had to pay out of pocket for her stay at the ridiculous rate of $11,000 per month for subpar service. Apparently, Medicaid won't start until she has less than $2,000 to her name, and you can't just give away your money to your next of kin. They actually look back 5 years to prevent that. It's the most disturbing and dystopian thing ever. She died a year later, practically penniless. Story 2. Before my oldest daughter was born, I picked out the hospital where she was to be born, verifying that they accepted our insurance and we were in network. Somehow, the delivery doctor was not in network, and we got stuck with a $40,000 bill. After months of arguing between myself, the insurance company, and the hospital, I told the hospital to go pound sand and change my phone number. I did not just check, I double and triple checked throughout the process to ensure I was not going to get stuck with a large bill. I have not heard from them in well over a decade, so that is that, I guess. Story 3. 1. My wife spent 6 days in a hospital, 4 of them with no diagnosis until a third doctor examined her and determined that her gallbladder needed to be removed. Thankfully, we have good insurance and everything turned out fine. A $1,494 ambulance ride for me that was only 12 minutes long. An emergency room doctor misdiagnosed our daughter as being allergic to my wife's breast milk and called my wife crazy and a danger to her newborn child. Thankfully, a pediatrician called him out on it. Story 4. I went to several doctors because of abdominal pain and was dismissed as it just being my period. This happened over the course of several months. I ended up going to the hospital because the pain became severe. They found white blood cells in my urine, so they assumed I had a urinary tract infection, but another nurse decided to do an ultrasound just in case it was appendicitis. It turns out I have a grape-sized tumor. Having lost my dad to cancer only a few months prior, I wasn't in a good headspace. They take me back to my room. My original nurse walks in, sees me crying, and in a very agitated tone says, "It's just a urinary tract infection. No need to cry over it." Story 5. My wife has 8 ruptured discs in her lumbar spine. Yes, all of them from S1 to T12. That is what the latest magnetic resonance imaging says. The insurance company is requiring her to go to physical therapy to see if that cures her back pain before they will discuss paying for surgery. Also, I'm walking around on a torn tendon and stretched ligaments that probably need surgery, but I have not been able to afford it for the last 20 years, so I just hurt when I walk and fall off that ankle a lot. Story 6. I was 23 and broke my ankle and went to the emergency room. The emergency room doctor said, "Walk on it as much as you can tolerate." And being 23 and thinking I was invincible, that night, I tried as hard as I could to put weight on it and heard a pop. From that point on, the swelling got worse and worse for 3 months straight. The orthopedist wouldn't see me and just kept sending me back to the emergency room. Eventually, 6 months later, I got the surgery I should have gotten at the very beginning. Except by that point, the bone had healed incorrectly. That surgery was botched. I got nerve damage from it, and they didn't fix the issue with the incorrectly healed bone. I was in terrible pain and lost my job and my insurance. I was very persistent though, refusing to give up on finding a job and exercising diligently to stay in shape. Unfortunately, the exercise made my ankle impingement worse, and the obsession with finding a job made me depressed. I developed complex regional pain syndrome, a condition where my ankle and foot were severely swollen, red, hot, and excruciatingly painful just from wearing a sock. It was 2010. There were very few job opportunities even if I could have worked. They gave me gabapentin, Lyrica, cortisone shots, antidepressants, you name it. Nothing helped. Surgeons wouldn't touch my foot. They were too afraid of the swelling and my lack of insurance. Eventually, I had so much pain that I couldn't sleep properly. I became extremely depressed when I realized my pain and my limp might be permanent. My husband had to drop out of school because I was unable to earn money. We had no health insurance. We had to move back in with my mother. Eventually, doctors flipped the script on me and said I was in pain because of depression. So I saw a therapist and a psychiatrist, but both were frustrated with my lack of progress. I did not progress because the pain was not being addressed at all. Now, every time I went to that hospital, the doctors wouldn't even talk about my ankle. They would redirect the conversation to my mental health. They thought I was crazy. They called me treatment resistant. They said I had a somatic disorder. When I talked about my goals, going to graduate school, having a child, they condescendingly told me that might be out of the question for me, with as mentally ill as I was. But I didn't qualify for any disability benefits either. So I couldn't even get food stamps. 6 years went by and I finally got health insurance again. I made an appointment at another hospital system. The doctor there took an X-ray and saw the piece of bone sticking out in the wrong way. He did surgery to shave it down, drilled some holes in my bone to create scar tissue to act like cartilage in the ankle joint, and I was better within 2 weeks. I ran in a 5-kilometer race that fall. I took the graduate record examination that winter and was accepted to graduate school, fully funded, that spring. I graduated with a master's degree 2 years later, then had a baby, and now I have a good job and stable life. I do believe it triggered rheumatoid arthritis, though. I was diagnosed with that later on. It was very stressful to have an untreated, incorrectly healed bone and trying to work and exercise while in that much pain, while being gaslit by doctors. I couldn't sleep properly for years, and I didn't have enough money to meet basic needs, all because I was disabled by pain for a few years. Rheumatoid arthritis is often triggered by a severe injury or stressful life event. So I guess that's my story about what it's like to not have health insurance, and to be so broken down by a mismanaged health issue that your own doctors start stigmatizing you and calling you crazy and discouraging you from having ambitions. I think if I had lived in a European country, things would have been better because I wouldn't have gone 6 years without any health insurance. After the first botched surgery, I would have been able to see another surgeon to fix it. And maybe they would have given me food stamps or maybe even some disability money until I got back on my feet, plus better job protection so I wouldn't have lost my job due to health issues. Story 7. Mine personally is running a 104-degree temperature for 3 days in the hospital and got minimal care. When I told admissions I didn't have insurance, it was like I had the plague and spent most of my time alone in a room. I was on fluids and that was it, no medication, and they only ran a test to tell me I might have strep. When I was finally released, I received a bill for around $10,000. Worst was my mother before she passed. In January of 2014, she went to see a doctor because she kept vomiting. They ran tests and told her she was fine. Fast forward to the beginning of June 2014, and she hadn't had a solid meal since December, but every time she went to see a doctor, they told her she was fine and sent her home. By the end of June, she died, and the new doctor we fought to get confirmed that she had brain cancer and that it had basically shut her stomach off, which is why she couldn't hold down food. It was difficult that she passed, but what was really awful was the $750,000 medical bill my dad got after she passed. Insurance paid for just $30,000 of it because most things like the room, most of the tests, and the oncology unit she was moved to weren't covered by my dad's insurance. Story 8. The dermatologist was also a plastic surgeon and leaned on that heavily. He told me to air dry after a shower when I said I was itchy all over and sent me on my way. 3 months later, after not returning my calls and being booked weeks in advance, he finally said, didn't we take a skin scraping last time? I responded, no, you didn't. It turned out I had scabies. He apologized, but I was so done and complained about him to my primary care doctor so she wouldn't recommend him in the future. Story 9. Last year, I accidentally swallowed a soda tab floating in my drink and went to the emergency room. The X-ray technicians did not speak to me, but about me, and laughed about how I was the oldest person they'd ever seen for a swallowing mishap. At one point, one of them said, "Are we exposing her to too much radiation?" And the other said, "No, it's probably fine." They found nothing and charged me $3,000 for the X-rays. This week, I broke my toe and my partner had to drag me to the emergency room because I didn't want to do it again. I cried the whole time they took the X-rays because I have no idea how I'll pay for the visit and the holidays coming up. Story 10. A patient at an office where I used to work needed a computed tomography scan of her abdomen. The doctor saw something on an X-ray that had him worried about cancer. Insurance denied the computed tomography scan because it could impact the patient's reproductive health to have so many scans right after each other. 2. It was 2 scans. This patient was also a 65-year-old woman. That same insurance company paid for her hysterectomy. What reproductive health are they protecting exactly? After a short and very rude phone call, they agreed to cover it. She did have cancer and would have died within the year had it not been caught. Story 11. I went in for a routine hernia repair. 3 days after surgery, I developed a high fever of 104 degrees. We called my doctor, who told us to go to the emergency room. I remember being wheeled up to the doors of the emergency room, then nothing until hours later after I had gone through a colostomy. The doctor had punctured my intestines, and a severe infection had developed. They went and cut my intestines in two and ran each side out through my stomach. I spent the next 4 months voiding my bowels into a plastic bag that was attached to my stomach. The medical team did not know if they would ever be able to hook my intestines back up so I could go to the bathroom normally. Eventually, they hooked me back up. I spent weeks in the hospital and rehabilitation facility each time they operated on my intestines. This was a very painful and stressful experience. I have also had 4 separate cancers over 26 years. I am a type 2 diabetic as well. Story 12. Don't know if I would count it, but I was having my first panic attack and actually thought I was dying. I chose to die before I was going to call an ambulance and pay for it. Thank God I didn't die, but it's sad that's what you think of in that moment. Story 13. Not an American, but we were on vacation in Florida in the 1990s when my little brother developed an ear infection, and we went to the hospital. I remember my dad being angry at the invoice because they charged him $8 per cotton swab. Also, a few years ago, my mom developed a bladder infection in Florida, and the visit cost her $3,800. Coming from Canada, this is unheard of. My dad just went through prostate surgery for cancer and major complications post-surgery. All we paid was daily parking to visit him. Story 14. Oh, I have a recent one. My partner is having a weird pain in his lower abdomen and doesn't have insurance. I called about 20 doctors in my area, and none of them will even see you if you're self-pay. There was one that only made an exception to see him because I was referred to him by my gynecologist's office. But when I asked how much a visit would cost, they said they couldn't tell us until after the visit. He will have to fly back home to Italy just to see if something is wrong. Story 15. I have a terrible insurance company. Let's call them Kaiser Permanente. I'm under 25, so I get insurance through my mom, who is out of state. The carryover between the 2 states' departments is reprehensible. A website glitch has left me unable to access my state's coverage. I went through customer service lines for 8 straight days before finally making it to the escalations department. When I listed the litany of hoops I'd had to jump through and explained that as long as the website was broken, I'd be unable to access my medications, medical records, or appointments, the guy expressed sympathy and told me they did not expect to see the issue resolved until 2026. I hung up and cried. Big old thank you to Kaiser Permanente. Story 16. Female veteran here. I have 2 hilariously great stories. I get coverage through the Veterans Affairs. As many people know, veterans are a sad bunch. The year 2021 was a horrifically bad year for me. My second mom died. I had custody of my teenage brother. I was 30, and my boyfriend was losing his mind on me constantly, all while working 40 hours a week and preparing to move to another state. Trying to be proactive, I tried to set up an appointment for mental health. Just the 10-minute intake took 2 months, and then I never heard back. At this point, I was actively trying not to harm myself, which I conveyed. I was simultaneously dealing with a female issue starting in January of 2021, where I would not stop bleeding for weeks on end, 2 to 3 weeks a month. I was trying to get in for a consult for that. I was told I was miscarrying and to go home. My ex was not local anymore, meaning I was completely sexually inactive. This went on for about 3 months until I finally snapped at a desk worker and shouted about me bleeding out in front of everyone. I was then put on a list for a consult in a week. They do the scans, say literally nothing. This is important. At this point, I have basically a 1.5-hour window where I can leave the house, and that's it. I finally go to the emergency room at 3 in the morning, explain the situation. I had a female doctor, and she was enraged that there was not even an option to put in a gynecological consult. She gives me very low-dose birth control to try to stop the bleeding. It helped a little bit. In August, I make the normally 10-hour drive to move. It took way longer due to my condition. I get signed up at the local clinic there where they have to do blood work as part of the intake. They do it 5 different times over the span of 2 weeks because the tests must be wonky. I get a voicemail very early in the morning telling me to go to the closest emergency room for a blood infusion because either I have blood cancer or I literally have no blood. I'm like, excuse me? I am now 10 hours away from anyone I know, except my boyfriend, and you lay this news on me via voicemail? All the while, I am now trying to get set up for mental health again because I am now sleeping roughly 1 to 3 hours a night inconsistently, and my eyes feel like they are melting out of my skull and I would like to blow my face off. Mental health sets up 3 different appointments and cancels all of them. The 4th reschedule, I lost my mind and told them they are the reason so many people harm themselves and that the doctor should go work in a cemetery to streamline the process. So I set aside mental health for now. Back to the blood. Apparently, I have a grapefruit-sized fibroid or cyst in my uterus that is not manageable anymore. How did I find this out? Because 2 months after my move to a different state with a different care provider, that provider casually calls me the Walking Dead and tells me that I basically have molasses for blood because my body can't keep up with how much I'm losing. I've lost about 50% of my hair density, but I chalk that up to stress. He informs me that if I don't get this in check, I would be dead by December. Meaning, if I had never moved, my brother would have woken up to my dead body one morning. Cool. What is their solution? Really nothing, because no surgeon would sign off on surgery because my blood volume was so low. So I continued taking the minimal amount of birth control and eventually didn't die. I still have the little issue in my uterus, and it has stayed within a functioning range since the start of 2022 after I weaned off the birth control. I found a lovely old therapist that I still check in with when I need. If left up to my original provider and without self-advocacy, freaking out, I would be dead.